Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and joining me today is a leader, a speaker, another podcaster with a varied background from finance to now as a stroke survivor leading other people through aphasia recovery, Angie Cauthorn. Thank you so much for being with me today.
Thank you for having me. This is a wonderful opportunity. I am a fan of your work. We met through our friend Rachel Foreman, and it was immediate sisterhood. It was immediate.
You know, she sensed it and she was right. She's so good at connecting like-minded people.
Yes, absolutely.
So for those of us, those listening who haven't met you before, will you tell us a little bit about your background, what led you to be passionate about healthcare? Obviously, as a survivor, your personal experience led you to the work you're doing now. Yeah, give us a little bit of your background and your story.
Well, my background, well, first of all, hello, all the listeners out there. My name is Angie Cauthorn. I am a two-time stroke survivor, and I am the host of a podcast called Brain Friends. Before my stroke, I worked in finance at one of the largest car dealerships in the country. And my whole life was numbers and communication and fast thinking. And after my stroke, I was diagnosed with aphasia, and that changed everything about how I process and how I communicate. What I realized pretty quick is that I started with some groups to try to help people, because I realized that pretty quickly that people leave the hospital and they're like medically stable, but they're really not prepared. There's a gap in the system of what's delivered, what's expected, and everything's coming at a survivor at like a high pace. So I wanted to create something that helped people kind of mitigate and be able to just receive information. Like I said, I worked in finance. Prior to that, I used to work at a little mom and pop shop called Radio Shack.
Now
Back in
that's
the
a joke. That doesn't mean that you were working at it since its inception as
No,
a because you're way too young for that.
exactly. I was there in their glory days of the 90s.
Ugh.
But yeah, so that's pretty much my shtick. I have the podcast. Oh, I'm the founder and co-founder and president of the Aphasia Resource Collaboration Hub. And it's a collection of all the resources that people can get help to find out about the aphasia camps, especially on the aphasia side, because aphasia is one of the larger mind communication disorders you can have, but it's not really well known. So I really wanted to be a place that people with aphasia could find people with aphasia and to find out about the research that's being done to help them. And
Yes,
so
exactly.
that's Arch. That's what Arch does. And then I have another small thing that you might like the name of.
Yeah. What could that be?
Do tell, friend. That is
Uh,
called R.O.S.A, and that stands for the Resource Orientation for Stroke and Aphasia.
that just makes my heart so happy. It has nothing to do with me, but I'd love to have something to do with it if I can ever help.
Well, I might just hold you up on that, because I tell you what is it's a structured community facing program. It's not a conference, it's not a support group, it's a convening, it's a orientation. So to help stroke survivors and care partners reconnect to care, understand what's happening in their brain, and to really truly have those next steps put in a way from a survivor who's walked that walk, who's been at that cliff, who understands what's really kind of going on, and can, a lot of times when we're getting that help as a survivor and the people at the hospital are doing all they can, we're just not in a position to receive it. It's like
Mhm.
getting water out of a water hose or a fire hydrant with a red cup. It's just going to hit the cup. You're not going to get all the water. It's too much force.
That's
So
true.
it's just in a position where we slow it down, and I try to provide some information. It's a half-day conference that's at Temple University this year, and has been every year. It's our 5th year for
Nice.
R.O.S.A. and we bring in people from all over, and we have a keynote speaker, we have activities, we have panels, and it's just a full day that people can kind of get in and learn about stroke, aphasia prevention so you don't have another stroke, and to just really also meet other people with aphasia, because a lot of that is the isolation that comes with it.
Yeah. And then you've been doing this 5 years now. And like we had a track that I led at our neuroscience conference last year, and it went really well. And we had panels, like you had mentioned. What are some of the activities that you do that you have found to be helpful for those attending?
I'm laughing because we had line dancing.
I definitely have to come. Please tell me that is on the roster for
It
this
is,
year.
it is.
Yes.
Um,
Okay.
we had
Because
line.
movement is good for your speech.
Yes, yes.
Yes.
And it was so much fun. And one of her name is Tanya Powell from DC. She is a line instructor, and she's a stroke survivor, actually an aneurysm survivor.
Really?
And
And
she runs this thing. And she was like, Angie, I'm coming down. And I'm like, well, we're gonna do it. So at the end of the session, we have a keynote speaker. Last year it was Dr. Charles Ellis from Florida University. And
Mhm.
he spoke and we did that. But one of the activities was line dancing.
Okay. Y'all
The
know how
other,
to have a good time.
yeah, no, we have a good time. We know how to, we had the choir. One year we had a gospel choir come in and perform at the end. And that was our first year we did it. And we learned a lot the first year. Like, it was too long of a day. That's what we,
Mhm.
but you do, that was year one. This is going to be our 5th year this year. So we're very proud of that. And Temple University and the board of ARCH, the Aphasia Resource Collaboration Hub, is a phenomenal board. Julie and Dr. Martin, they've really been instrumental in just making sure that ARCH is a phenomenal host for this conference.
Yeah. That is incredible work that you're doing. And it's so needed because it's not something that is widespreadly available. So I wonder if, you've worked out some of the kinks of this, if there's like a pattern that other places could put on similar events. Is that something that you've like tried to roll out in other areas?
Not as of yet, because as of right now, we're in the infancy. We were born in COVID. So it, everything kind of came in a very different ways that it was just things were scattered and not normal, obviously. So we haven't made it to go to other places, or I haven't yet. And for the record, I would like to say that R.O.S.A is hosted by Arch, but it can be done anywhere. So if the state of Kentucky wanted to bring me out to facilitate that, we could absolutely do that. And I could talk to Tanya and see if she can help us with some line dancing. But you know what I want to do? You know what I want to do? I really want
Yes.
to do for our fun activity this year. I want to do a lip syncing contest.
Ooh, that is so on point. I love it.
Right, because karaoke, well, we may not be able to
Yes.
sing that great, or you might not like your voice. And though singing never is always a different part of the brain, so most people can actually get the song. But if it's not about the song, it's about you acting out the song.
I
That's
love
something we can do. So that's what I was thinking about for our fun activity. And we always have a keynote speaker. Oh, one other thing I do want to say about Arch. We
Mhm.
have the Science of Aphasia, which is a quarterly meeting we have every 3 months. And we also have the Science of Aphasia. The Science of Aphasia is for clinicians. Hear about a clinical publication by the author, comes and talks about the paper. And the Science of Aphasia is just what it sounds like. We talk about the science of the brain damage that causes aphasia and the different parts that are, once you're in it, you do want to know from a clinician or a scientist or a researcher that's working on things. And they explain some of the things that people are going through in real time. And the last thing I want to tell you is about the Aphasia Fantasy Football League.
What? Oh my goodness. What does this even mean?
The AFFL, which I am the commissioner, call me the commish. Okay. We have an Aphasia Fantasy Football League. We run it on the ESPN app. I think that's, yeah. And We have a fantasy football league. So you pick your team like you would in regular old fantasy football. We meet every Wednesday during the football season from 6:30 to 7. We talk
Okay.
trash. It is
Okay.
not a support group, okay? Don't come in here thinking it's a kumbaya situation. Wear your gear and talk
All
some
right.
smack, okay? We will wait for you to get it out.
Hey, there are so many instances where we'll be talking to somebody and they can't get their words out, but they'll get frustrated and those cuss words come out real easy.
Listen,
I know you raise their blood pressure and they get those wires firing. Yep.
yeah. And in a football room, it's a really nice space and it's very cool because it's not a support group. It's fantasy football and
High energy.
it's high energy and we come in and if you cannot speak, you don't want to speak, you don't have to. You don't even have to show up to the meetings. But you do have to set your league. So let's say somebody wants to play, but they're not ready to really truly participate yet for whatever reason. That's okay. You could be home and not wanting to talk, or you might be at work, but you're still part.
Yeah.
So that's been great as well. So that's some of the things that we work on.
That's awesome. Oh my goodness. I never would have thought of that. That's a great idea. Building community. That's a great way to
Yes,
build
it
community.
is. And I always felt like when I also I'm a co-facilitator for the NAA's back room, the Black Aphasia call, which conversation group, I'm sorry, for aphasia. And I always felt like sometimes, especially during football season, right before the call, everybody's talking smack about their team. And then it's like, okay, time for the call. Well, why can't that be the call?
Right?
You
That's
know what
what
I
they want
mean? That's what we
anyway.
want to talk about. Why are we talking about this other stuff? So I wanted to create, anytime I see a hole, I want to make sure that we're addressing it.
Yeah.
And what
Fill that
about people
gap.
yeah, let's fill that gap. So that's what I've been working on.
Angie, I love how you think. That's so organic how it came about, but I can see it translating into a lot of different areas. Because a lot of the times I think when like clinicians are trying to help people, we overthink things too much and try to make them fit in like an academic way instead of just like how would they be going about their real life? And they would be if they would normally enjoy being part of a Final Fantasy League, but maybe now with aphasia they don't feel comfortable with the people that they were previously doing that with. Give
Yes,
them a
all the
group where they
time.
can talk smack, and if they need extra time getting their words out, the people in the group understand what's going
Yes.
on.
Or if you can't set your league, you don't know how to set. Now, listen, I tell you what, don't come in here if you don't know nothing about football. Don't do that. This is
Okay, I
not,
won't come because I
no,
don't know
yeah, listen, this is not, I am not here to teach you the game of football. Okay. If you don't know what's up, don't come in here. I'm telling you right now. This is not a support group. I mean, yeah. Yeah. This is after
but if
dinner
they need help
brandy.
with the setting it up as far as like
Yes. Yes.
because
But
that
right.
stroke affected their ability to read and write or whatever, right?
We got you. Then we
Okay.
have you. But if you don't know the difference between a running back and a quarterback and a fullback, don't come in here.
Okay.
Don't do that because you're just,
Gotta set
nah.
those boundaries.
No, listen, I am not, because again, this is not a support group.
Yeah.
This
That's a
is,
good delineation. And do you have choirs as well as part of Arch? Is there a
no,
choir?
but the Philadelphia, oh my goodness, pack, the Philadelphia Aphasia community at Temple.
Hmm.
They
So there is one.
Oh yes, and they perform at Arch at Rosa every year.
Okay.
And that's ran via Temple University. Gail DD has a phenomenal aphasia group at Temple, and so yeah, the choir sings the Pack Choir, and they are
Beautiful.
fabulous, fabulous. So I
That's
was a
awesome.
member of that for a while too, but I'm just loud and off key, so I didn't want to do that.
Well, I'm glad you had that opportunity, though. You got to make a joyful noise.
Got to make a joyful noise.
Yeah. Well, let's take this to how we would scale up because you have great ideas that you are putting legs to where you are. But I ask every guest on this podcast a signature question. which is if you were given a grant, Angie, for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
That is such a phenomenal question and such a great signature way to get people really thinking. If money were not the issue, how would you respond? And for me, I would invest in building like a national clinic, a community infrastructure for stroke and aphasia recovery that would include three major areas. First, I would standardize post-discharge navigation programs so every stroke survivor and the family, the caregivers, with a clear, understandable pathway to the resources and to the support. Second, I would invest in community-based education and access, kind of what Rosa does, especially in underserved communities, so people can find the services and the support groups, because a lot of times they're there, but people don't know how to access them. And I don't feel like people should have to scrap for every bit of information. I think it should be readily available in the world that we live in today. And third, I would fund survivor-centered research, workforce development, and healthcare systems that value the lived experience, the patient-reported outcomes, and make care more equitable and better for everybody.
Well, amen. I'm
All
on
right
board.
now.
Let's do it.
I
I
mean,
love
if I had $1 billion, and I might take a nice little something for myself, I'm not going to lie. There might be just a little something. I
Well,
can
I
do all
mean,
of that from a cruise, right?
oh my goodness, right? We'd need an aphasia support cruise.
Yeah. Which is awesome, actually. They do have them. I have to,
Well,
you know.
next week, I'm actually going on a Nurse Con at Sea cruise with Nurse Blake. Have you heard of him? He's a nurse comedian, and he created a continuing education cruise that looks like way too much fun. But my book, Speak Up, Start Now, is going to be in the swag bag for all 3,000 nurses on the cruise.
Yes. Throw a sticker for Brain Friends in there, would you?
Yeah, you better mail it in the mail real fast.
I'm good.
But
I'm
yeah,
good.
I
But no,
hear you.
that is wonderful. And real quick, since we're on your podcast, I want to know um, about your podcast. How many years have you been running it?
This particular one,
Mm-hmm.
I guess a year and a half.
So there was more.
I have 4, yeah.
You have 4 podcasts?
I started with the Lou Review in Louisville, Kentucky, and I'll just edit this part out. But the Lou Review is a podcast I started locally, interviewing local business owners and nonprofit leaders in the Louisville, Kentucky area about what they do and spotlighting them because they are making this area great. And it started in 2020 because that was the year of Breonna Taylor in Louisville, Kentucky, where that's all anybody knew about this city. And there were so many great people doing such great work here. And then especially we started it in July when restaurants were starting to open back up after the shutdowns. And we wanted to show like if they were doing like having opening safely and, how they're make people feel safe to support the local businesses that were having a really hard time. And so it really grew from that. Like that podcast has had over 25,000 downloads. I haven't even looked at it really recently because I just keep doing it because I'm not doing it to look at the numbers. I'm just doing
Right.
it for the community involvement.
Yeah.
But I learned how to be a foodie influencer from that. And my boss at Norton invited me to create the Stronger After Stroke podcast for my patients. So she was like, take some time and come up with some topics and who you would interview. And 2 hours later, I was back in her office with 2 pages of topics and who I would interview. Because at this point, I'd already been the stroke navigator for a couple of years after being in the ICU with stroke patients for 8 years before that. So I knew the frequently asked questions and I knew the information that I wished I could give to everybody, but didn't have time to have those conversations at length with everyone. So Stronger After Stroke won first place at the International Stroke Conference in 2024. And After that, a ton of people were reaching out to me saying, I want to be a guest on your podcast. And I was like, I'm sure you do, but you have nothing to do with stroke or Louisville,
Girl,
Kentucky. So that
girl,
doesn't.
can I tell you, I had somebody that does breast work asked me to be on my podcast this last week. And I'm like, what? I'm like,
Why?
okay, I've reached into that. And I'm like, don't do that. Just, no.
It's like, pay better attention, people. Like, do you even know what you're doing?
No, yeah, I'm just going to, no, absolutely.
So it's not mine, but I'm consulting with the University of Miami on their Aging Like a Pro podcast, and they fly me out to Miami to interview their brain health experts about aging and dementia prevention. And so the Aging Like a Pro podcast, we're actually going to be re-releasing the first episodes in like a more concise series, but that's been really cool. So I'm actually hoping to ramp up my consulting for podcast creation and continuing education content after this.
That's awesome. Yeah, you are killing it like me. I love that.
I'm trying to, but my day job is really holding me back.
That's a great thing. That's a great thing. That's a great problem to have because when you say, okay, you know what, I can take less hours at the hospital because I got other stuff that's popping off. That's a great thing.
Well, I'm on salary, so I would just have to quit, though.
Yeah. Well, you might be able to find a ramp down. You ain't got to quit. Maybe you would have to quit. Yeah. Then you got to slow walk that thing. I get that.
Well, it's okay. I'm ready.
Okay. Oh.
The thing is, it's like I've gone global. That's local.
Right. No, for sure. And how many countries are you in?
The Stronger After Stroke podcast that I do for Norton Healthcare, it's heard in 100 countries. I don't look at the stats on this podcast like that for Nurse Rosa's Insights. I'm more trying to build the community through like LinkedIn and social media and things like that. And so I put it into clips and share it that way to raise awareness. And I really want to do more for Be Fast and raising awareness in that, because the more I talk to neurosurgeons, for example, who will pull a clot out of somebody's brain and they're like, I can do it at 24 hours, but if they get to me at 2 hours, it's going to have a lot better outcome. And there's only so much that I can do at 24 hours. So really, if we want to have the better outcomes, we need the earlier recognition of symptoms. And so if I were given a grant for $1 billion, I would put it towards earlier recognition. I would use a chunk of it for Be Fast education on all the TV and radio channels across the country. And I would love to just go out there and do it myself or recruit people and like do a whole marketing campaign around that. And then the rest of it, I would want to designate for improving systems of EMS care, especially in rural areas, because that's another time factor. If somebody recognizes it right away, but it takes 2 hours for the ambulance to get to them,
oh my God,
then that's a heartbreaking barrier.
Ooh.
And I think there are solutions. They just need to be ramped up. So that's what I would do with it. So I'd be on like the front end, and then you would be on the back end. So we need $2 billion.
That is awesome and here's the thing about the Be Fast thing, because I called the night I had my stroke, we called and the guy came. I always refer to him, I don't want to be disparaging, but I was calling the little boy that came in here because he was like, oh, you're probably just having a panic attack. Now, had I listened to him, your face, your whole demeanor, you're like, what else he'd say?
As you're a woman, was he going to say that to you if you were a man?
Come on, let's talk about it. No, exactly. And that's the whole thing. So,
it is.
But then I also found out, I did an interview with, the Stroke Association new guidelines that came out. And I learned from Dr. Sham that the EMTs weren't trained on what to truly look for until 2019 for a guideline. So the little boy didn't know, and I didn't find that out but the bottom line is, my hand is drooping and I can't talk. That's 2 of the fast right there. So
Who
I,
has a
I,
panic attack with that happening?
I don't know. And I'm like, and I, as good as I could say it, I'm like, son, I don't do panic attacks. I promise you. I don't know what this is, but I
Don't do.
don't do, I promise you on everything I love, this is not a panic. I don't know what it is, but I promise you, it ain't that. I don't do that. I'm not, that is not in my wheelhouse, brother. And he was like, all right, I'll take you if you want to, like, if you want to make a federal case out of it. But if I'm not,
They will
and
take people to the ER for a freaking pregnancy test. Why are we having this conversation?
exactly, exactly,
So
exactly. And it was like, no, you should take me. And so he took me and he proceeded to tell the doctors that, again, there's probably nothing wrong with her. And I had to literally give the doctor,
introducing bias where maybe there wouldn't be any
I
before.
had to literally give the ER doctor my business card.
So they
Yeah.
would know, don't mess with this one.
Yeah, I gave him my business card to say, listen, I know how to talk. I probably sold somebody in your family. I probably did that paperwork for that car you got out, that Subaru you're driving. I probably did the paperwork for that. I'm the one that takes care of all. I promise you, I'm not some crazy drug induced lady. I got to open the dealership in the morning. I got to get out of here. You have no idea. I mean, because I was very lucid. I just couldn't talk and my hand was like just closing and I couldn't,
Oh,
and they were like the nonchalantness that I know now, for what I know now, it should have never happened like that. It should have never happened like that. But,
you
you
just
know,
need one person to say the word stroke, and everybody's like, oh, wait a minute. We're going to do things quickly now.
yes. And it obviously it never crossed their mind. But again, that injection of bias of,
Yeah.
you know, she probably is just trying to, I'm like, listen, I need to get out of here to open the dealership in the morning. And I haven't been back to work since. And I loved my job. You know, and that's what people don't take into account either. And another thing I would do with $1 billion is make sure that people have access after an event like this to be able to live.
Yeah.
Because
Exactly.
they don't understand, you know, if you don't have the insurance, and even if you have all the best insurances, that's still only 60% of what you already couldn't live off of. Come on now.
Right. And so I think, and one other resource that I think is not tapped into enough is vocational rehab.
Yes.
Because vocational rehab, I don't know the differences via state. So if I say something that's not accurate from one state to another, I'm sorry. But they evaluate to see like what you're able to do now, and you may not be able to do what your job was before, but that doesn't mean you can't have any job. And a lot of
Exactly.
people need work for purpose, for structure, for benefits, and all those
Yes.
things. And so they identify, okay, but what work can you do? And then they also have relationships with employers where those employers know they need to find people through the Office of Vocational Rehab to prevent those people from going on disability. And you might think, well, just go on disability. That's easy. No, that's like an 18-month process if you even qualify.
If you even qualify.
Yeah, so that's not an immediate solution for anyone. And so I really wish more people knew about the Office of Vocational Rehab so that they could tap into those resources from the state that are there to prevent disability, to prevent people from being on, I don't know, what do you want to call welfare? Well,
Mm-hmm.
this is how help them have a career. It might look different than it
Right.
was before, but they need to know if they can't do this high communication job they did or this high speed job they did before. They can do something else that's still contributing to society, give
Mm-hmm.
them meaning, and provide an income for them and their family.
Exactly. And you will, I mean, there's obviously a loss generally financially, but again, it's about the purpose. It's about, and that's why I wound up doing the work. I wound up the advocacy work because honestly, it was hurting my arm to play Madden all day. So I couldn't sit around, I couldn't sit around playing 2K and Madden all day. I wish I could give you, I just really wanted to do the work. It was like, all right, well, I guess I can't do this and be proud. So let me find something I can be proud of that I've done. But
You're crazy.
my first inclination was, I'm going to sit here and play 2K until I get better. And then I realized better is very elusive after a stroke, and it's not going to mean what you think it means. The biggest thing I found out was that stroke recovery is not linear. And what I mean by that is it is not a broken arm. It's not a broken arm. And that's the part that
Ebbs and
people don't,
flows, right?
the ebbs and flows, and the fact that it's not, it'll be fine if I'll just wait it out. That's not how brain injury, brain recovery works. And I think figuring that part out was like, oh, I can sit here until it gets better. And then you realize that better, it's not necessarily better, it's just different. And that takes time to realize. So, but
And
that's,
also, if you don't use it, you lose it. Where
ooh,
if
ain't that the truth?
you're using it, then you might lose what you have.
Bit you got. And neuroplasticity is the good news, is that there is neuroplasticity and that there is hope. And that hope comes from putting that work in. But I mean, grueling is the word that came to mind, but I don't want to oversell it. But man, it's tough, but it's worth it. It's worth it. So just continue to show up every day and do what's necessary.
Exactly. Well, Angie, you are an inspiration. The work that you have started, paying it forward and helping others with what you've learned from your own experience in Arch, in the ROSA conference, has just been so amazing. And I'm so thankful for it and ready to learn more from it. So if people want to connect with you, is LinkedIn the best way to do it? Or would you rather they reach out through Art?
LinkedIn is fine. LinkedIn, they can just search for Angie Cauthorn. I have the podcast, which is Brain Friends, the podcast, available in all the places where you get your stuff. And there you go.
All right. Well, thank you so much for joining me today. I'll have all your links in the show notes below. So
Shout
if you
out.
enjoyed so if you
Sorry, I have to say that.
conversation, be sure to check that out, like and subscribe wherever you are listening, or if you're watching on YouTube. Let us know if you learned something or if you have more questions, and I'll see you in the next episode.